And a very pleasant good afternoon, ladies and gentlemen. Chris Babcock coming to you live and direct from the heart of the high desert here with one of our partners, El Paso Physical Therapy Services here, right at the Shops at Horizon, right off of Restaurant Row. And this is going to be a monthly thing we're going to be doing with them, talking about physical therapy and some of the tools they use to help you or someone you know recover from injury. I know that firsthand that my wife is here. She's using El Paso Physical Therapy. They are helping her with an ankle injury. So I really believe in what they're doing, and now we get to show you exactly what, if one of your family members or yourself might need it, this is what we're doing. And today we're talking with Isaac. Isaac, how are you doing?
I'm pretty good. How about yourself, Chris?
Pretty good here. Now, we have a patient, and I know she's trying to avoid the camera, but that's okay. Say hi.
Hi.
Okay, so what are we looking at today? What are we showing our audience?
So today what we're presenting is a tool that we use here in the clinic. It's called blood flow restriction training. And it's a personalized tourniquet system that we use. And if you want to kind of zoom in on it, it's this right here. And so what we do, this machine, when we get a patient that comes in here due to they just had surgery, it's an elder individual who's experiencing weakness, an individual who experienced an injury at work, they had a sprain or strain, and they're just suffering from strength deficits. This machine allows us to improve their strength without using maximal amounts of weights, which you normally would need to improve strength. And so this induces a physiological effect. And so we're trying to achieve that strength gain and then that muscle growth without adding too much resistance or weight.
Now, I notice this is a tourniquet system, and looks like some sort of pressurized tube. Is that what it does? It actually constricts the blood flow?
So that's exactly what it does. So what it does is it calculates the individual's blood pressure, and then depending on where we're trying to treat the upper extremity or the lower extremity, it'll calculate 50% of the upper extremity or 80% of that blood pressure of the lower extremity. And so once it calculates that, we'll take them through a program where it's 4 working sets of 30 repetitions, 15 repetitions, 15 repetitions, and then another 15. And the reason we do that is because it's backed by evidence and research. And that's what the latest research is showing, and that's what's improved strength and muscle growth in patients.
I can tell you firsthand that some of the physical therapy that my wife went through, she said it is probably the most intense that she has ever done, and this is for her ankle. So now we're trying it on this at her leg.
Yes. So we're going to pretend or assume that Maria just went through ACL surgery. And so she has a lot of weakness, some possibly muscle atrophy that she's experiencing from. And so we're going to use a blood flow restriction tourniquet system to improve her muscular growth and strength. And so what we're going to do is calculate her blood pressure right now. And so what I'm going to do is kind of just come up here. And we're going to do it for strength. And so right now we're going to calculate her blood pressure.
And it's pretty much just like a regular BP cup.
Pretty much, yes.
So right now it's monitoring it, it's checking the pulse that each one of those beats.
Correct.
Now, when we're talking about these types of equipment, this is literally state-of-the-art stuff.
It definitely is. So blood flow restriction actually started in the 1960s in Japan, and it was known as Katsu training. And so they started with some of that training over there, and they found some effects where when they were restricting the blood flow, they would induce these muscle growth and muscle strength. I apologize.
That's quite all right. It's technology. I know how it goes. Yeah. So basically, it's an advanced form of resistance training, almost similar to that.
Correct. So like I said previously, instead of using, you would need to use anywhere from 60 to 100% of an individual's 1 rep max to achieve that muscular strength and growth. Well, this allows us to use anywhere from 15% to 30%.
And basically, it would be, for instance, if somebody's elderly, they're not going to sit there and do like 150 weight pushes. This is the exact same thing, but without as much weight.
Exactly, just as you stated. I mean, so an elder individual, we're not going to be able to put a lot of weight on them. This allows us to use less resistance and then achieve the same outcome of muscular strength and growth.
So again, if you just join us, we're here at El Paso Physical Therapy Services here in Horizon. You don't have to go into town anymore. You can come right here and have your physical therapy here in the high desert. So here we go. He's going to go and get another read now. You can actually hear the cup inflating as it's increasing its pressure on our willing test subject here, who's grinning and bearing it very nicely. Oh, wow. Okay, so
it just calculated her blood pressure. And so what we're gonna do now is we're gonna set the machine. So what we're gonna ask Maria to do now is stand up. And so we're gonna assume that Maria's a little bit more advanced in her program already through therapy, and we're gonna ask her to do mini squats, which is a common exercise that we have our patients who are post ACL reconstruction do. And so as you can see here, the machine's already set up to go through a program of 30 reps, 15, 15, and 15. Okay, and that's the program we're gonna follow her through. So we're gonna set it up. And so now we're gonna inflate the cuff. And so now Maria's gonna start the exercises. And you'll notice the first two sets, they're gonna be relatively easy for her. Once she starts getting into the third set and ultimately the fourth set, you'll start seeing her strain a little bit more. And that's when that effect is really taking into effect, or that process of that physiological adaptation for strength and growth.
And again, most of these are just your standard squats. This is not anything different than you would do, maybe warming up or anything. It's just with the apparatus.
Exactly.
Wow, that's amazing that it's able to do it. You can see it on this side. It's actually calculating the resistance on it every time she goes down. And you get a shot of it. And this is amazing. It's not much larger than a small coffee maker. It's just amazing what the technology can do.
Definitely.
And this is something. This is pretty much what you guys have here not only at this one, but at all your locations.
Correct. So we do have a location off of Lee Trevino and Traywood. That's El Paso Physical Therapy Services, our East Clinic, and then one off of Dew Street on the west side.
And what do they have to do to actually come in and get you guys in the service? Because I know a lot of people in Horizon leave, and they have to make a whole day of it. How do they get to make sure that you guys are their physical therapist?
So ultimately, they go see their physician first, or their surgeon, depending on what's going on with them, and then the surgeon will, if the surgeon felt or physician felt like they needed therapy, they would make a referral for it, and then if they live around the area of Horizon, we're closest to them, they would just ask them, "Can I go to El Paso Physical Therapy Services with a referral?"
And then simple, just they come right here and you guys take care of them.
Correct.
Which is pretty much what my wife's done anyway. And now she's looking forward to, but not too looking forward to the next one because it was a very big strain. So she's done with the first set.
Okay. So then she's done with the first set. We're gonna allow her to rest for 30 seconds.
And it's right now. It's just basically counting down, going to rest.
Correct. So this is just a rest period right now. And then once it hits 0, it'll ding, just alerting us to start it over again.
So the bottom dial, if you can see it right there, is the timer, and it's down to 3, 2, and 1, and there you go.
She'll start the second set.
Now I noticed that it's got a timer on the button. It says 5 minutes 39 seconds. Is that the time to complete, if there's, or is that the entire session?
So that's the entire session. So within that 8-minute period, she should be able to do the 30, 15, 15, and 15.
And that's part of the calculations of her blood pressure and the resistance.
Correct.
Wow, that is amazing technology. Again, here at El Paso Physical Therapy Services, here in Horizon, just a small piece of the technology that you'll be able to use once you come in and get this taken care of. So this is the second set of 15, and she'll have another set of 15, correct?
So 15, yes. So we're going to allow her to rest for 30 seconds again.
And how are you feeling?
Tired.
Tired already. Have you done resistance training, not with this, but like with just regular squats and lifting and weights? How do you feel the difference?
This one is more, not painful, but it's more, I don't know how to say it.
Maybe concentrated. Maybe it's just like you can feel it inside more.
I feel it more than weights.
Wow. See, and that's good because you talked about it a little bit, about how they actually, the more reps, the better, and really right now they're being 100% monitored.
Yes, definitely. So it works great, especially on athletes, high schoolers, middle schoolers that play sports and they're suffering from an injury, from a sprain or strain, and they want to get back on the field, on the court, whatever it is that they play, a lot quicker, because we're using that research-based physiological effect that we're trying to achieve to improve strength and muscular growth.
Okay, so now she's just about ready, just about done with the third set, and I can see a little bit more struggle, she's slowed down, the breathing has started getting a little bit loud, but again, this is the benefit of this little piece of equipment, is that it is not weights, it is not putting a load on the system, as it were.
Exactly, but let's say the patient was a little bit more advanced through their rehab program, we can add some weight on there to make it a little bit more challenging for them.
Well, let's see, so maybe she wants to have some weights after this.
So that was...
All right, so that's the next to last setting. That's the next to last reps there with another 30 seconds. And again, they can come in and out once you get the appointment set. Not just with this, but with their other. What's the normal time for them to come in and out and have a session?
So normal time is anywhere from an hour to an hour and 15 max. We know people are busy, they got things to do, but they definitely need the rehab, so we try to get them in and out.
And it's very quick. Again, I can tell you, my wife, again, working on that ankle, she came in and out. It was less than an hour. And, she told me, she said, this is probably the most intense workout that I've had. And it was just a very short amount of time.
Yes. And so
All right,
now she's going on to her very last set. And as you can see, this is where the struggle really is.
I think somebody's going to get a nice treat after this because she's not really injured. She's just doing this to be a good model, as it were.
Exactly, yes. She's definitely being a model.
And again, there's no variation in the actual squats. It's just a standard squat. It's just that pressure that's putting that blood flow in there.
Correct. It's just restricting the blood flow, which increases what we call anaerobic effect in the muscle. And so it's reducing that oxygen that's being pushed to the muscles, which increases that fatigue.
And that's those reps. We just want to make sure that they've got them and it's safe. So this is just amazing. Oh, she's got a couple more to go. 2 more. And 1 more. There you go. So then will it show a final report or what will it do?
And so we'll stop it right there. Okay, and then good. And so we already finished right there, so we're going to deflate it.
And a sigh of relief comes from the crowd.
All right, and so we want to go see her stats, which is that deflate all the way.
She still had 2 minutes left on the clock. You can go for another 15 if you want. There's plenty of time.
Okay, good. And then so back, strength. Okay, so we didn't set it up to actually
to measure it, but it would have like the statistics
correct.
there.
So the statistics are right here, but let's say we wanted to keep track of what the patient was doing, it would be all right here in statistics.
Wow, that is amazing technology. And again, this technology available to anyone who needs physical therapy here in the high desert. You don't need to go into town anymore. You can come right here. And again, right in the heart of our little city, right across from Walmart, in the shops at Horizon. You've seen them. That's where we have the big old Farmers and Artisans Fair. But again, El Paso Physical Therapy Services right here. Any final words for anybody who can be watching?
Thank you, Chris, for coming in and just demonstrating the equipment and tools that we have to offer to the Horizon community. We're definitely trying to make an impact and be part of the community here, and we welcome anybody that wants to come and receive services from us. And if you just want to check out our clinic, come by. And
a phone number they can reach you at?
Phone number is 915. Help me out here, Rosie. 872 9333.
933. You can see their sign right across from TFCU, right across from Walmart. Now, this is going to be a monthly thing, so we'll post this video. If you guys missed it, if you need anybody to take a look at it, you'll be able to see it for the rest of the month here on horizoncity.com and on our Facebook page. And then next month, we'll be back with Isaac with another issue. But for now, Chris Babcock for Isaac and Maria, who's now, her color has returned. We will see you guys. Hey, don't forget, we got the farmers market this weekend, and we will see you there. But for now, Chris Babcock saying, have a good day, everybody.